Welcome back, y'all. Welcome back. I hope y'all enjoyed the groove. It seemed like we did from what was shared in the chat box. So thank you, DJ Shavar and DJ Glenn. Thank you all for the tunes for that. I hope y'all enjoyed the presentation by Damon Jacobs. I know I did. I had a few key takeaways from that. I think one thing was the importance of partnership and collaboration, right? How you're using that to like leverage our efforts, right, and the work that we're doing in this case, right, when we think about a biomedical strategy such as PrEP, and then through that, right, the need for support, right, when we think about stigma that is associated with even the work that we do, or the strategies that are out there, or folks who may be consuming those strategies or utilizing those strategies. So there are stigmas, and that comes from a lot of myths and misconceptions, right? So if we have the partners or the beautiful aspect of partnerships, right, it helps to debunk some of that. It helps to allow for the more support to come along with that. So thank you, Damon, for sharing, right, your experience and the work that you all are doing when it comes to like PrEP engagement. So thank you, thank you, thank you. So I'm hoping that we can now hear from one another, right? And we still have Damon who's going to be in the space who can offer some tidbits, right, to what we're going to be discussing in this part of the conversation. But with this, it's a chance for us to hear from one another, for us to highlight and showcase some of the work that we're doing when we think about opportunities, right, to increase PrEP, the utilization of PrEP, and what are we doing, right, to think about the messages to increase awareness around that as well. So we can get the next slide, please. All right. So here's the first question that I have for you all. And it really is around what are some previous strategies your agency has used to increase awareness and utilization of PrEP? And let us know, like, what are those successes and lessons learned from your efforts? So let's hear from you. Let's showcase, let's highlight what we've been doing. And if you may not want to share like through your voice, which I would love to hear your voice and see your face, please use the chat box as well, and we'll definitely acknowledge what's been shared in the chat box. So let us hear from you. What are some of your strategies that you're using or have used to increase awareness and utilization of PrEP?
Hi, this is Nigad from Hawaii.
Hey, Nigad.
So we made PrEP a part of our contracts with the AIDS service organizations. So to ensure that they work with the people with the at-risk or the vulnerable populations, and get them engaged with PrEP and help them navigate the system to get PrEP.
Thank you, Nigad, for that. So again, what we're looking at is, again, another effective way of partnership and what comes from that. So thank you, thank you. Others want to share and highlight?
Hi, I apologize for being late, y'all. I was in another Zoom. The EHE Zoom was earlier at 10 o'clock, 10 to 11:30. But I know what has been a success for us at the Open LGBTQ Community Center, not only being word of mouth and using physical images and advertisements to get the community in a conversation about PrEP and or PEP, is during our testing experiences, presenting an incentive, and giving like a number to like maybe like the first 25 or 30 people to test for HIV. We present you with a $25 gift card or a $50 gift card, something like that. And then, finding out of the result from the testing, should someone be eligible for PrEP, then that's a good segue or a warm handoff to one of our clinicians in the Glenburg Clinic. So that's really been a success for us and a high point for our clinical services.
Good work. Yeah, incentives are great. I just was watching this morning, hearing like certain stores like stores are giving away like $20 for getting a flu shot, So again, incentives do work. Something that's enticing. We understand medical mistrust. We all understand that it's a huge part, right? As to why folks may not access. So giving that incentive as a way to entice folks so they can receive the message is a great way. We have Robert, and then we got Katie. Go ahead.
Hi, Anshay. Good to see you. I wanted to just, I guess, probably remind a lot of people that in the 2021 PrEP CDC PrEP guidelines, they use the phrase that every sexually active adolescent and adult should learn about PrEP. And they say that so that it's not defined on some boxes that you might check to identify that you might be at risk for HIV or something like that. It's an overarching educational, I think, philosophy that every sexually active person, adolescent or adult, should know about PrEP. And I would add to that anybody who is contemplating becoming sexually active as well. So in how that plays out, I think, is in clinics or in any agency or organization where there's a conversation about HIV testing, HIV prevention, that we're obligated to bring up PrEP, and I would add to that PEP as well, so that people do not walk out of your door not knowing about that. And then if you're in a clinic setting where you have an electronic medical record, you can come up with some documentation that every person that you meet has had a conversation about PrEP and PEP.
Thank you, Robert. I love the idea, right, of using, for instance, like federal government mandates or guidelines to support, right, opportunities to further inform communities or partners around, what we can do, right, to engage those when it comes to PrEP. Katie, go ahead.
Good afternoon. Thank you. We have skilled and trained PrEP navigators who are able to help people break down the barriers to get on PrEP, with those insurance barriers, maybe some things that they're struggling with in life, in order to be able to increase the PrEP uptake in our health department.
Thank you, Katie. And I just want to acknowledge what's in the chat box as well. It's like we have a good little conversation going on in the chat box. We have one of the strategies, this by Luciano, around one of the strategies is to identify those key people, gatekeepers who know the community firsthand. And these gatekeepers can open and close doors. From there, Luciano also mentioned around also discussing PrEP with people living with HIV and how their partners can stay HIV negative, as well as U equals U. This is where Greg co-signed with that. And then Luciana added more, right, around discussing PrEP with all clients who come in HIV STI testing, right? And now that we have injectable PrEP, just more options for clients. To co-sign what Katie mentioned, this is where Nagat made mention around, they also have PrEP navigators. We also heard more around partnerships, right? And this is what Christine co-signed with that around, we have not used social media yet to increase awareness as of date, but they will be working on it. They do prompt PrEP on all their STI case investigations and find large amount of people in their community who do not know about PrEP. And also Norma added in around how they are doing outreach events in the community. So we have a lot that's happening, right? And thank you all for adding so much sauce to this conversation. I think this is great. Where we also have Araceli, who made mention about working with our local LGBTQ centers to educate about PrEP. So if others want to chime in, please do, or those who shared in the chat box. For instance, Luciano, you gave us a lot. If you want to add more to it by, sharing your voice to the conversation, please feel free. We welcome that.
It's Damon, can I say something?
Yes, come on in, Damon.
One of the things I saw in the chat box too, which is really valuable, is the idea, oftentimes we don't get to meet people or see people till there's a problem, till they're coming in with something itching, burning, or twitching. Right. So when someone's coming in because they've been exposed to an STI or think they may have been exposed to an STI, that is really, no matter who the person is, no matter what their gender is, no matter what their sexual patterns are, that is really the ideal time. Sorry, I'm in New York City. You can hear the ambulance. That is really the ideal time to explore HIV testing. And if they're HIV negative, to ask them to consider PrEP, because if you're positive for an STI, or possibly positive for an STI, you are quite likely a really appropriate candidate for PrEP. And then it's not just about being, oh, you're, a slut, which is a term I use very affectionately. But, that's kind of how the providers often see it. It's like, okay, well, you're a sexually active gay man who's coming in with syphilis all the time, so you need PrEP. Let's get away from that frame. Not that that isn't sometimes appropriate, but let's expand that framework for anyone who's coming in with having any kind of risk in any kind of sexual activity, and say, how can we help you? How can we support you to have the very best sex life possible that you wish to have?
Reframing, I love it. Thank you, Damon. Thank you for that. Do others want to chime in around that and thinking about opportunities for reframing and opportunities to like engage individuals when they come in and see you?
Hi, my name is Sophia. I'm new to this group, so thank you, everyone. Really, really a lot of learning. I just wanted to offer maybe a small perspective from organizing a national network, one of my previous jobs, a national network of people living with HIV, TGNC BIPOC, is that most of the time, the biggest barrier to PrEP or even treatment was that they don't get gender affirming care. And so sometimes it might not, like even speaking with providers, it might not make sense for them. What does this have to do with this? One time a provider told me, I dangle undetectable to get them like a carrot to get them to so I tell them basically, if you don't take your pill and you don't become undetectable, I won't give you hormones. Whereas, from our community, we know that we actually want to be us first. We need reasons basically to feel our own self-worth, our own value before we think about, okay, like basically answer the question, why should I live? Or why should I take the pill if I'm not myself? If I go to a clinic, PrEP clinic or other types of clinics and I'm misgendered, they're not going to even, continue in that process. So just sometimes maybe addressing what's not like, yeah, I don't know what the word is, I lost the word, but like sometimes, it might not make sense for people to talk about gender affirming care when they're there to get PrEP or to get treatment, let's say later on, but actually tackling that first helps.
Thank you so much for that, Sophia. It just made me think about an opportunity, right? Just to get to know the person, and what that can really do and how that can really support the individual. And also what it made me think about was the need for ongoing provider education. I know Damien made mention around this earlier, around the benefit or the importance of provider education, because many medical providers are just there just to treat what they see, right? But not to really understand the person, who they are, their existence and all that good stuff. So again, a need for provider education would be great, right? Because it allows them to understand the need for gender affirming care, how to support, maybe what questions to ask, how to do some reframing, all that good stuff, how to work, how to create that relationship with the client, right, as a provider in a way where it definitely offers that support and allow for engagement to continue. Thank you. And we also have just some other folks in the chat box just to acknowledge, like Shelly, around their online list of providers statewide who prescribe PrEP. And we post on social media to promote knowledge of that list, so that way folks can have access to that list and know who's there, who are the PrEP champions, right? Who they can go to around PrEP. We also see Luciano mention around just asking a question around the open to having a list of email contact lists, because they have a great deal of talent, wisdom in that group. And also they need to remember that client can at times choose PrEP depending on their risk and dating scenario. And remember PrEP on demand using 211. And Arceli just commented around that it's a challenge when they're facing in their community getting providers on board to prescribe PrEP. So folks may want to share around just some of that, navigating the challenges of getting providers on board. I see, Robert, you have your hand up. So yeah, maybe folks want to chime in real quick around how they get providers on board, and then Robert will come right to you. Damien, maybe you have any suggestions or tips?
As far as getting providers on board, I think the understanding what the obstacles are. I think most of us work with providers whose heart are in the right place, but there's things that get in the way. A lot of them are traumatized. A lot of the providers that are around today lost patients in the worst days of the AIDS crisis, and they associate condomless sex with death and disease. And so it's understanding that and working with them to help them sort of separate their synaptic connection between sexual play with multiple partners without condoms, with the death and trauma that they experienced throughout the 1980s and 90s. And that's a lot of what I've been doing, is saying, I know your heart's in your right place. I know your intentions are in the right place. And we want to respect the science and the information that's forthcoming that allows us to proceed through this. And a lot of times providers have to go through their own stages of change in order to get there, if that makes sense. And I love what, and I just want to also say, thanks Sophia for what they were saying. Like, this idea of harm reduction is about meeting someone where they're at. It's not saying, oh, this is what you should be doing. I actually wrote a book about the word should and why that doesn't work in healthcare. It's not about should, it's about saying, what do you want? What are your values? What are your goals? What are your dreams? How do I fit into your framework and aspirations? Not the other way around. When we can help providers get that, sometimes then they get really on board with like, yes, this is actually a really, really amazing opportunity that we haven't had historically. And I want to be on board with this. And I have seen many providers come around going that route.
Thank you, Damon. Thank you. And Robert, go ahead.
Thanks, Anshe. I wanted to follow up on Luciano's last comment in the chat about people choosing PrEP. I think that for a long time, and I think this has changed happily, but is still happening in some places, is that people have to be deemed eligible, quote unquote, for PrEP. And that the clinician or even the PrEP navigator is some kind of a judge or a gatekeeper on who can qualify for PrEP. And I think that it really does a disservice to the patient, to the client, to the person. It undermines their own autonomy. We can't expect that everybody who sits down to have a conversation with us about HIV prevention is going to feel comfortable telling us everything that they're doing. And just the fact that they ask for PrEP should be the real only criteria for offering them PrEP.
May I jump in again? I'm so sorry. I don't want to interrupt. I just really like to respond to that. Is that okay? Robert, you're right. And last year in 2021, the CDC changed their guidelines and they updated their guidelines because of consumer pressure like that, like you're saying. Everybody on this call, all 101 of you, are in a position to be part of that change. This is how the CDC changes their guidelines. So they changed them last year. So you no longer had to be qualified. You no longer had to be an official slut in order to get PrEP. They changed it last year so that anyone inquiring about PrEP is appropriate to receive PrEP. Exactly for the reasons Robert just said, that, you know, people they can't always talk about her. They're not always feeling comfortable telling a doctor in a sterile room about their sex lives. So the CDC changed it, but they changed it because of community pressure. And most people don't know that. So when the CDC actually makes a reasonable and compassionate and science-based changes to their PrEP guidelines, it's really important that all of us on these kinds of calls make sure that we're bringing that back into our agencies and organizations, because rarely do agencies and organizations stay on top of all the things the CDC is changing. But the CDC absolutely changed their wording on that exactly for the reasons you just said.
Thank you for that acknowledgement, Damon. Thank you. So what we're going to do is move to the next question. I love this, and we have a lot that's happening in the chat box. I love that folks are on this conversation. Thank you, thank you. So with question 2 is, reflect on the session presentation. What is one strategy you will consider to educate communities about PrEP on social media? So again, just reflect on the session presentation. What is one strategy you will consider to educate communities about PrEP on social media? So like the first question, we heard a lot of opportunities to educate providers. This time around, let's think about ways to educate communities. And with that, maybe this can help with getting this conversation going, because Sophia has a question in the chat box, and I think this can go with this discussion question. And it is around what has been people's experiences increasing awareness and PrEP utilization for uninsured folks. So as we think about ways to educate communities about PrEP on social media, what does that look like for folks who are uninsured?
Hi, my name is Gloria. I'm a health educator at UCSD here in San Diego. And I think one of the strategies to educate the community that I really liked was the community driven media campaign. I think those are very powerful because it comes from the community, and, especially if it's someone really well known in the community, it can really help, drive engagement. Thank you.
Yes, getting those well-known or influencers, getting them involved will be a great way, right, to increase opportunities, right, to educate folks around PrEP. And then Che, I see you have your hand up. Go ahead.
Hi, so I'm in California, so it's probably a little bit different from some places, but the way that my agency has been helping uninsured people is that we offer PrEP starter packs in our clinic, and those go, and then we refer them directly to our PrEP navigator. There are so many different options for free PrEP with California programs, but also Gilead Pharmaceuticals has their own PrEP access that is really, really helpful for people who are uninsured or underinsured. So I would definitely recommend that you guys reach out to local Gilead reps and find out if they can provide you with information and contacts for that. But that's because that's the one that we hear a lot in California is, well, I've heard PrEP is expensive. It's like, well, here it's really not. Like, we will give it to you. We will do whatever we can to get you to take this. And also, a lot of agencies are picking up the injectable PrEP, like Aperture, I know is covered by Medi-Cal now. So that's also an option for people who might be underinsured. Just really make sure that you're utilizing the company that puts it out and any kind of providers that you can find. Like, really ask around and like push really hard for your counties. We had to fight really hard to get them to give us the PrEP starter packs, but we know that that's a whole different game. If we can start them that day, they don't have to go to the doctor first. They don't have to go through all this stuff. We just test them for HIV and gonorrhea and chlamydia and hep C. As long as all of those come back, they can be on it, and they have these options. So definitely speak to any county places that you might have and see if anyone can help you with that side. That would just be my suggestion.
Thank you, Che. That was really helpful. And I do agree, working with local pharmaceuticals, and they all usually have like a community liaison in each of your jurisdictions. And so being able to partner with them to support folks who may be uninsured to gain access, right, to PrEP is amazing. So that's one way of doing that. And I love the idea of the PrEP starter kits too, as another way to initiate PrEP for individuals. So thank you. Damon, thank you also for the resources via the links that you shared in the chat box. Those are great ways to begin to access, right, tools or resources for individuals who are uninsured. So yeah, do others have anything they want to add to the conversation, thinking about strategies they would consider to educate communities about PrEP on social media? We see in the chat box that some folks are gearing up to do free basic Zoom classes on PrEP and PEP, and also inform guests about their transgender services in their office. That's amazing. Thank you for that, Norma. John from New Mexico made mention around they create a project funded out of New Mexico Department of Health that provides PrEP to anyone, no matter insurance or documentation status. That's great. So they have mid-level nurse who are based out of Department of Health office that will prescribe PrEP and also for syphilis cases, partially funded by STD funds too to support. So another entry point into PrEP. And Luciano mentioned about it is key for PrEP providers to establish relationships with Gilead liaisons who can provide PrEP starter packs to licensed medical staff. Yes, yes, yes. So it's like we had a lot when we think about our strategies that we can consider to educate communities about PrEP through partnership, right? And that's another way to leverage our social media efforts, right? When we're thinking about ways to educate communities on PrEP, giving folks, right, those resources via our social media, on those social media platforms, so they can be able to easily access that as well. So question 3, because we're running low on time, how would you engage your internal and external partners in supporting your social media strategies? We heard some already, but let's hear a little bit more and thinking about what would be their roles. And when we're thinking about engaging our internal and external partners in supporting our social media strategies. Have folks done any of that yet? Maybe want to share? Any internal, external partners that you would think about engaging or may have engaged? And what were their roles in this process?
Can I'll just jump in? I don't have a perfect answer, but here's, like I talked about on Facebook, like we started creating community around talking for real about sex and pleasure and fun and joy. And I understood as a part of that, it was important for me to be open about that, to be vulnerable about that. That's different from how I was trained as a therapist. As a therapist, I was trained not to do that. As someone who wanted to be part of education and empowerment, it was important that I be vulnerable. It was important that I be honest about what I was dealing with and the trauma I had been through the AIDS crisis and what PrEP allowed me to feel as a sexual person. And I had never talked about that stuff publicly before. Once I started doing that, other people started doing that. Once we had community around that, people started coming to us. Scruff came to us. The World Health Organization came to us. We started creating an energy, and other external partners wanted to work with us and be part of this and say, how can we either be part of this or how can we support what you're doing? But again, it kind of just started with that foundation of creating community around sexual pleasure and safety in these very sensitive conversations.
Thank you. Transparency and vulnerability. I love it. How about you, Robert? You're going to chime on in. Go ahead.
I'm going to chime in for the 3rd time. I feel so dominant today. One of the challenges, especially in public health departments, are the extensive approval processes and firewalls that IT departments put up against using social media. And that works at, in my opinion, at direct odds with our mission here. And so I think that advocating to the people in leadership for them to basically tell IT they have to allow us to use these platforms and to figure out a way to use them safely is really important. It's I know of a couple large counties in California that have to go through a lengthy approval process to use certain apps and certain social media platforms, which is, in my opinion, ridiculous and certainly counterproductive.
Thank you, Robert. Thank you for that. And I think that it's critical, right? Understanding those firewalls and those internal barriers that you may encounter, right? You think about rolling out your social media campaign. I do know that on session 1 of this learning collaborative, we had Michael Weiss who shared more of their process. And I think it's Humboldt County Health Department. I may have gotten the name wrong, but he shared around the experiences or navigating, right, those firewalls and what it's like when it comes to like rolling out social media campaigns from a health department, and what they had to do when they had to tackle those things. So those recordings will be on the website coming soon. So if you missed that session 1, as Robert talked about navigating firewalls, you can hear a little bit more from Michael Weiss, who shared more of that in session 1. I'm going to acknowledge some of the things that were shared in the chat box before we close out, since we have a few more minutes. But, you know, Shelly made mention around the program makes a monthly calendar of suggested social media posts, which is great, right? Finding ways to coordinate that. And we share it via email with partners. There are always PrEP posts on the calendar. And I would like to see more partner agencies share the posts, though. I don't think we always connect with the right staff person or agencies, which have limitations on how they can use social media, which is, again, understanding what those challenges and how we're going to navigate those challenges. Shavar added in there that CBO partners are contracted agencies with more flexibility to leverage social media. The health department is another possibility to explore, right? So thinking about those CBOs that are out there who can help do that for you or make that possible for you. And then, you know, Arceli agreed with what Shavar made mention of. And just, I'm sorry, around just agreeing around the having to jump through hoops to get materials posted on social media. And Cheryl said, co-signed the same thing. And just also acknowledge that Michelle from ViiV Healthcare is also in the space. So thank you, Michelle. But Michelle put out there that you can reach out to them around who may be your local ViiV account manager, and they can better connect you. So that's another access there for folks who maybe wanting to know, how can I support those who are uninsured or maybe struggling to navigating access to PrEP. So thank you all. This was a whole lot. I see we still are flowing in the chat box, and I love this, and I appreciate you all for your participation in today's session. I'm going to turn it over to Shavar, who's going to close us out.